many compressions and breaths should you do for each cycle of CPR? 2. What causes anaphylactic shock? 3. What are the symptoms of third-degree burn? 4. What is the first thing you should do for severe bleeding? 5. Which of the first 8 duties below has the highest priority for you as a cabin attendant? 6. What is the main purpose of the route emergency transportation technique when providing treatment to a passenger? 7. What is your first action when examining the condition of a patient? 8. What is the main purpose of the hind leg procedure? 9. What happens with the carbonic acid dioxide, CO2, produced by the human body? 10. What can you do to avoid that a person experiences a short period of unconsciousness, fainting? 11. What applies to a victim with a reduced consciousness? 12. How can you recognize a vein bleeding? 13. Where do you position the knot in the end of the bandages of our emergency bandage? 14. Which of the items mentioned below can cause a shock? 15. What should you do for shock? 16. What do you do for small cut? 17. What is included in the CPR procedure? 18. What can cause the blood circulation stop?
അതുപോലെ നിങ്ങളുടെ പ്രിയപ്പെട്ടവർക്കും പുകവലി നിങ്ങൾക്ക് ദോഷകരമാണ്.
19. What do you do if someone suddenly begins to bleed severely? 20. What are the symptoms of hypothermia? 21. What is the best treatment of second-degree burn? 22. How do you check for breathing? 23. A nosebleed can be stopped by 24. Which of the first 8 duties below has the highest priority for you as a cabin attendant? 25. What is your first action when examining the condition of a patient? 26. What is the correct procedure when treating with the aid? 27. What are the requirements for a cover bandage? 28. What do you have to do when a passenger has no breathing? 29. 29. What is the purpose of the Heimlich procedure? 30. How can you recognize an arterial bleeding? 31. List what FAST stand for. 32. How many compressions and breathings should you do for each cycle of CPR? Adult. 33. A passenger has been stung by a honeybee. The stinger is still under the skin and needs to be removed to prevent anaphylactic shock. What do you do next? 34. A person is allergic for peanut butter and is going into anaphylactic shock. What do you do next? 35. What does ABC stand for? More answers. 36. When performing chest compressions on an adult, we press the chest. 37. When dealing with an unconscious casualty, you should check up to seconds for normal breathing. 38. Having a pulse is a sign of medical shock. 39. What is a scold? 40. What do you do when someone breaks an arm? 41. Choose all of the factors in the list below that contribute to date rape. 43. Abuser promised to change. 44. The victim believes the abuser will change. 45. Victim is edgy and tries not to upset the abuser. 46. Abuser feels sorry and guilty. 47. Abuser has mood swings and is unpredictable. 48. Abuser forcefully, verbally, or sexually assaults the victim. 49. Abuser emphasizes how much they love the victim. 50. Abuser constantly criticizes the victim. 51. Most poisoning take place in the home. 52. The risk of rape is higher for women ages 30 to 40 than for women of other ages. 53. Most acquaintance rapes involve the use of alcohol on the part of the victim, the assailant, or both. 54. Kids who are victims by bullies tend to get lower grades. 55. The difference between playful teasing and harassment is the person's intent. 56. Comments can be considered sexual harassment even if the target welcomes the comment. 57. The first responder law helps protect people HWNE. They render first aid. 58. Gossiping and spreading rumors is an attempt to damage a person's reputation. 59. If someone is having a seizure, you should put something in their mouth so they don't bite their tongue. Stung 60. Harassment is all about power and control.
അവൻ ആര്, എന്തിനിവിടെ വന്നു എന്നാലോചിച്ചുകൊണ്ടിരിക്കുകയായിരുന്നു. എന്നാൽ ഇപ്പോൾ മനസ്സിലായി, അവൻ കെട്ടുകഥകളെ യാഥാർത്ഥ്യമാക്കുവാൻ വന്നതാണെന്ന്.